All right, knee pain and stiffness. This is what you need to do first to help get rid of it, okay? So a lot of times people come to us with knee pain and stiffness and they've lost a little bit of range of motion, and they lose it this way because of the swelling sometimes. And then they also lose it, and this one they don't know they've lost it as much, but they also lose it going into extension. And the ability to fully extend the knee is key to actually getting better, because unless your knee can fully extend, then you tend to limp a little bit, right? So your knee just stays slightly bent like this and you limp. And so that's what we want to show you today, is how do you get your knee into full extension, because that's super important if you have knee pain. And it's
important to turn your quad on,
yes,
and use your quad the right way.
Yes.
You need a straight knee.
Right, like you can't fully get your quad strong unless your knee goes straight. And straight is actually a little bit of hyperextension. All right, so let's take a look at my knee here. So basically, if your knee is slightly bent like this, and most people would say that looks straight, but to go fully straight, you have to actually go past extension, and then when you squeeze the quad, you should see that kneecap come up. So it's sort of like the back of the knee pushes down towards the ground and the heel comes up. Let's look at this. Let's look at this actually on the ground. Let's do this. Okay, so if you're laying flat like this or almost flat, then what you should see is when you squeeze, I'm having a hard time doing it. Okay, so when you fully squeeze, you should feel like the heel comes up just a little bit. Are you getting that, Maddie? Okay, so just like that. So it's pushing down to the point that the heel pops just a little bit. So that's what we need by getting the knee straight. So a lot of times if you have some knee pain or some stiffness in your knee, that's hard to do. And so your knee just sort of stays slightly bent. And it does help if you come see a physical therapist, right? And we'll be able to do some soft tissue work on the leg, work on your hamstrings a little bit to relax them, and help put some pressure on to push it straight. But let's say you want to do this at home. All right, Nadine, you hop up there. If you want to do this at home, what we recommend doing is actually getting like a bag, and you're going to put your foot through the bag, and then you're going to put the straps on either side. Explain what that does, Nadine. I'll get some weight for you.
So we are trying to give your knee a little bit of overpressure into that extension position. So when you have it straight out without anything on it, you're still kind of letting gravity do its job. But when you have something weighted, now we're actually giving that overpressure and pushing down into that extension in a seated position.
Yeah, so I put a 5-pound weight in there, which doesn't seem super heavy at first, but it would actually get pretty heavy if you're having some issues with your knee. And the idea of this is you want it to be low load, meaning not a lot of weight, and long duration, meaning you should be able to do it for like 15 or 20 minutes. So a lot of times with our patients, we'll have them, if they're watching a little bit of TV, reading a book or something, or even at work, like put your leg out, put a bag around it so there's a strap on either side of the knee, and it's just like our hands pushing down on the knee. And that just slowly helps them get some knee extension. Okay, so then the next progression from that, you don't want that weight in there?
No, it's gonna smush my afternoon snack.
Oh, shoot, okay. So then the next progression of that, so as you get the range of motion, you actually need to then reinforce that with a muscle contraction. So we like to do this one, which is knee extension with a band. So go ahead and back up there a little bit. Good. So with this one, what Nadine's going to do is bend the knee just a little bit and put your right foot forward a little bit more. There you go. And then let the heel come up and then really push down and squeeze your heel into the ground while you squeeze just your quad. And the key with doing this is actually standing up nice and straight like Nadine is doing. If she would bend forward a little bit, then people tend to use their glutes and their hamstrings, and they're really not getting the quad going. So we can definitely see Nadine is using her quad there, not her glute and hamstring. So this, reinforces that extension that we got, hopefully from doing a little bit of manual work or using the bag to hang on there. And then it's really important to get this knee extension with your foot on the ground, because this is actually how you use your quads. All right, so then we go from there, range of motion, to this more of like, I would call this more of like a neuromuscular reeducation type thing, getting your knee to go into full extension with your foot on the ground. Now let's turn this into an actual exercise. And to do that, we do a step up. So we'll come over here to the step. So when Nadine does the step up, she wants to make sure that she goes into full knee extension on the stance leg when she stands up. So she goes all the way to there, fully extends the knee, pauses for just a second, owns that position, does it again. Good. So a lot of times we see Nadine show us where people just sort of keep their knee slightly bent, just sort of that, and then they come back down. Again, they're not using that extension. So make sure when you do this, if you're trying to build the quad up, which is going to build some muscle around your knee, you need to go into full extension to do that, into that full lockout position. Sometimes people think that's bad for your knee, but it's not. As long as you're guiding it into the extension, you wouldn't want to come up and just like snap your knee into extension. That wouldn't be great. So that's the progression. If you're having some pain and stiffness in the knee, maybe a little bit of swelling, you need to get that full hyperextension, full extension right away as soon as you can if you're going to get better. So you would do the passive method here with the weighted bag, neuromuscular re-ed with the band pushing back, and then work into an actual exercise with the step up, all with knee extension. Okay, got anything to add?
So this is a great one for people who have had any kind of knee surgeries in the past too. A lot of times people work really hard on getting it to bend again, but don't necessarily focus on can it straighten just as much as the other one. So great one to think about if you've had surgery in the past and you're still having some stiffness in there. And then another tip that I give some of my patients is during your icing time, so if you're using an ice pack on your knee or an ice machine, that's a great time to have it extended. Use the ice almost as a weight. You can even put the ice on and then a bag too if you want to. Typically you're icing for about 15-20 minutes. You can kind of kill two birds, one stone.
Yeah, that's a great tip. Yeah, we do often have people do that. All right, cool. Well, thanks for watching, and we'll see you next time.